Hi class, this is Molly Manweiler and I'm looking forward to presenting on the various leadership roles DNP, FNP graduates can pursue, as well as the ways we can measure effectiveness in these roles. Given the nature of this topic, I have elected to take a more educational approach to this presentation as opposed to making it a pros and cons type of debate. Please take some time to respond to the discussion question at the end of the presentation. Healthcare in our country has become increasingly complex for patients and providers alike. In 2001, the Institute of Medicine first advocated for expansion of advanced practice nursing roles to meet the needs of patients and communities with complex health issues. The DNP was an answer to the IOM's healthcare concerns as well as future healthcare needs. Nurses were no longer just seen as those who would teach future generations to provide care at the bedside, but also as clinicians involved in the development of research using evidence-based practices, advocates for healthcare policies, leaders, mentors, and expert clinicians. On October 25, 2004, the American Association of Colleges of Nursing, the AACN, voted to endorse the position statement on the practice doctorate in nursing. This decision called for moving the current level of preparation necessary for advanced nursing practice from the master's degree to the doctorate level by the year 2015. This endorsement was preceded by at least 4 years of research and consensus building by an AACN task force charged with examining the need for the practice doctorate with a variety of stakeholder groups. According to the AACN, the DNP is designed for nurses seeking a terminal degree in nursing and offers an alternative to research-focused doctoral programs. According to the ACN, DNP-prepared nurses are well equipped to fully implement the science developed by nurse researchers prepared in PhD, DNS, and other research-focused nursing doctorates. Essentially, the DNP was developed to enable the nursing profession to prepare professionals as advanced practice providers of care and as senior leaders within healthcare organizations. This presentation will attempt to explore some of the leadership options for DNP, FNP graduates outlined on the left hand of this slide. I think it is important to keep in mind that not all leadership roles carry fancy titles or large salaries. In fact, some of the most important nurse leaders never receive formal recognition. The second half of the presentation will focus on the ways we can measure the effectiveness of leaders. By the end of the presentation, you should have a good understanding of how you can serve as a nurse leader upon graduation, as well as ways to measure your future successes. As I mentioned earlier, the state of healthcare today has challenged nursing to take on many different roles. One of those roles involves influencing healthcare policy. DNP-prepared nurses can advocate for patient health promotion and influence health policy in a number of ways, such as voting in local and national elections, communicating with political representatives, running for political office themselves, as well as becoming members in professional organizations like those shown on the right. Active participation in a professional organization provides a DNP-prepared nurse with insight on the issues involving healthcare. It helps create and support a political voice for nurses that can be influential at the local, state, and federal levels. Membership also allows for analysis of policy processes and provides a DNP with the ability to engage in political action that can help foster changes in healthcare. Please feel free to share your experience with a professional nursing organization or your experience in policy development in the discussion section following this presentation. Inherent to the decision to become a DNP is the intent to become a nurse leader. In fact, the AACN indicated that one of the essentials of the DNP is to become a competent leader. DNP leaders challenge care and administrative processes while looking for innovative ways for improvement. As leaders in healthcare, DNPs have to be professionals that engage others to perform tasks that will be beneficial to healthcare organizations and populations. This is an essential characteristic and attribute that drives the DNP leader to promote change. There are a variety of ways for DNPs to pursue leadership roles within their organizations. The right side of that slide shows a list compiled by Loyola University in New Orleans of organizational leadership roles that DNP-prepared nurses can pursue. As I'm sure you can see by the length of this list, there are quite a few possibilities. The role of mentor is another effective way for DNPs to show leadership as well as influence health policies and clinical practice. It is not the most well recognized, high paying leadership role, but mentoring is an aspect of nursing leadership that is vital to the progression of the nursing profession. Young, in 2009, found that mentoring serves as a basis for clinical knowledge and skill, promotes professional development, and increases job satisfaction. A recent study in the Journal of Clinical Nursing examined the impact of an action learning mentoring program for advanced practice nurses. The study found that a formal, structured mentoring program was an effective way to enhance clinical leadership skills among Australian nurse practitioner candidates. The researchers concluded that mentoring can help nurses to transition into new roles and to develop knowledge and skills in clinical leadership that are essential for advanced practice. Serving as a clinical preceptor is one example of how DNP FNP graduates can serve as mentors for other nurses. Mentors model and form a path for others to follow, which is a component of leadership. As clinical mentors, DNPs can challenge their mentees to think outside the box and establish goals for them to advance their career in the nursing profession. If anyone in class has served as a nurse mentor for a student or colleague, please tell us about your experience by posting to the discussion board below. Traditionally, nursing leadership has provided a sort of elusive, immeasurable benefit to healthcare organizations and patients. Recently, the graduate nurse leader role has evolved to meet the demands of an increasingly complicated healthcare system. Accordingly, the American Organization of Nurse Executives has created 8 competencies that detail the skills, knowledge, and abilities to guide the practice of nurse leaders regardless of their educational level, title, or setting. The competencies include communication and relationship management, knowledge of the healthcare environment, leadership, professionalism, and business skills and principles. And you can see those outlined in the image on the right and how they kind of all work together. In doing research for this presentation, it quickly became obvious how difficult it is to quantify effective nurse leadership. That being said, I did come across a descriptive, qualitative study that examines the use of reports to evaluate nurse leaders' success based on the American Organization of Nurse Executives competencies. The researchers acknowledge that there are large role gaps between positions like chief nursing officer and associate nurse managers. However, within the study, they aim to understand the measures of success across the hierarchical spectrum of various nurse leaders. They found that upward reports most valued business skills and knowledge of the healthcare environment, while downward reports most valued communication, leadership skills, and professionalism. The researchers concluded that glaring discrepancies still exist in how we define our nurse leaders' success. In order to resolve these inconsistencies, Adams and Ducic recommend nurse leaders customize their interactions with different constituent groups based on what each group values the most. In addition to upward and downward reports, professional practice environment ratings, patient outcomes, and satisfaction surveys can be used to measure nurse leader success. A positive practice environment has been linked to quality patient outcomes, which senior level executives value, as well as these quality patient outcomes promote increased staff satisfaction. According to the Agency for Healthcare Research and Quality, measuring health outcomes is essential to assessing quality of care. Outcome measures include things like infection rates, length of stay, and hospital readmissions. But I wonder, just because a particular department prevents CAUTIs and has the fewest patients readmitted to the hospital within 30 days, does that really mean that their manager is the most effective leader? I don't know. A better measure of nursing leadership quality in some cases may be the dreaded patient satisfaction survey. In a recent study, patient satisfaction scores were used to evaluate perceived quality of care and overall satisfaction amongst HIV and non-HIV patients in Zambia. The researchers found a direct positive correlation between perceived care quality and patient satisfaction for both patients with HIV and those without the virus. My point here is that there are a lot of factors to consider when measuring nurse leaders' success or shortcomings. Depending on your role or practice environment, certain quality indicators may be more important than others. My hope is that this presentation has inspired you to become an influential nurse leader upon graduating from the DNP FNP program at Colorado Mesa University. As you have learned, there are a variety of ways to function as a leader within the DNP's scope of practice. It is important that each of us find the unique leadership role that meets our needs as well as the needs of our patients, our colleagues, and our communities. Future research on this topic should focus on developing criteria to evaluate DNP's effectiveness in specific leadership roles. Without evidence-based measures, it is difficult to assess our successes and shortcomings as nurse leaders. I hope you all enjoyed my presentation and have gained a deeper understanding of the leadership roles that DNP FNP graduates can pursue. With current healthcare policies advocating for expanding the roles of nurse leaders, there is a pressing need for professional doctorate nurses to fill gaps in nursing faculty education. Currently, only 1% of educated nurses have doctoral degrees. Lack of doctoral prepared nurses affects the number of nurses who are able to gain knowledge from expert nurse educators and clinicians. In other words, more DNPs are urgently needed to educate the next generation of nurses. As future DNP FNP graduates and nurse leaders, how will we resolve this pressing issue? I look forward to hearing your responses below, and I'll try to get back to everyone's responses in a timely manner. The page just shows my references. Again, I hope you guys enjoyed my presentation. Thank you so much for watching, and I look forward to watching all of yours. Have a great night.